health issues. Had no idea, of course, that we would be dealing with the coronavirus. We interviewed some great people. On February 26, 2019, I was able to announce that Dr. Amy Acton had accepted my invitation to become the Director of Health in the state of Ohio. With her leadership and help in the first year, we focused on some very important things. Lead paint poisoning, infant mortality, youth homelessness, suicide prevention, and just really the modernization of our public health system and a number of other issues. When the coronavirus hit China and we started seeing this on TV, Dr. Acton started talking with me about that. Her wise advice and counsel and her relationships with other doctors, other experts around the country and around the world have truly been invaluable, and they have helped us get through this, at least get through the first part of this. While the decisions were always mine, her counsel has been superb. And I will always believe and know that many, many lives have been saved because of the advice that I received from her and from the great work that she did. This week, Dr. Acton told me that she feels it is time for her to step down as our Director of Health. I have persuaded her to stay on as my chief advisor in regard to health issues. As chief health advisor, she will continue to be able to serve the people of the state of Ohio in a very, very meaningful way and continue to help me in a very meaningful way. I have asked Lance Himes, who served as past Ohio Department of Health interim director, to assume that role again as interim director, and he has agreed to do that. It is difficult for me to put in words and express how grateful I am for Dr. Acton's service to the people of the state. Her tireless service to the people of Ohio has clearly made a huge, huge difference. No one that I've ever met has a more passion for helping people, has a more passion for public health than Dr. Amy Acton. She always has put the health and safety of Ohioans first and foremost. Her knowledge, her compassion, her determination have set an example for all of us. Her extraordinary bedside manner, her ability to communicate, her ability to talk about complicated issues, or at least issues that I think are complicated, medical issues, and put it into language that we all can understand, has been superb and has helped us as we have moved through this pandemic. In her new role, she will take a comprehensive and holistic approach to addressing health and well-being for all Ohioans. In addition to advising on health issues, she will continue to focus on the COVID-19 crisis while remaining committed to the vision of the department. So I've asked her to step back, take a bigger picture look. She's been immersed, as we all have, since the beginning of the COVID epidemic on that. But she's now going to have the opportunity to really look at what she started to do, which is public health issues that affect all Ohioans over and beyond the COVID-19. With Dr. Acton's continued guidance and counsel, we will not only work to protect Ohioans against the virus, but we will focus diligently on creating a lasting environment where all Ohioans can lead healthy lives. We will work on building up our public health system and systems throughout the state of Ohio. And so I look forward to continuing that work with her. It's true, not all heroes wear capes. Some of them do, in fact, wear a white coat. And this particular hero's white coat is embossed with the name Dr. Amy Acton. Dr. Acton, thank you for your great service. We are very, very grateful. I will now turn it over to you.
Thank you, Governor. Thank you, Lieutenant Governor. Good afternoon, everyone. So I'm very grateful the Governor has given me a few moments to just share with you some of my thoughts about where we've come from and where we're going, and a chance to share my appreciation with a few people. So thank you for giving me this opportunity, Governor. And, you know, this was not a job that I ever saw in my life. And when I got that call to serve, you know, my hope was to really create a space and for the health and well-being of all Ohioans, because it became so clear to me that our governor is deeply passionate, and I have seen that. I've been able to witness that from this unique vantage point. It's just an honor of a lifetime. But I think it's a mistake to see all of what has happened as me, so if you'll bear with me. I've often said the tip of the iceberg. I laughed when you said about some of the words in bedside manner. I'm thinking about things like Swiss cheese and layers and lexicon and new vocabulary that we've all created together. But truly, I just had the opportunity to be representative of many people. First of all, the Ohio Department of Health. And to Lance Himes, he was a past director, stayed to be my deputy director, and I couldn't feel better about having him as our leader as we move forward in modernizing the public health system. ODH, you are my colleagues. Some of you I've known on and off through different parts of my life, and I look forward to this ongoing work with you. One day, and the way I often do, this happens to me, that I get my words backwards, and this one day we went to talk about for the good of the order, and I said, so thank you, go on for the order of the good. And that became a catchphrase for us at ODH. We often talk about the order of the good. They have worked tirelessly. Over 1,100 people have worked tirelessly, always for you, but certainly since January when we began this journey. And I see them as the order of the good. And then the local health departments, to the leadership of 113 local health departments and their employees. This, honestly, Ohio, are people that often live quietly, doing things for you that we don't see because they're doing such a good job. And they've been working tirelessly in this. And I just want to say, I'm so grateful to serve alongside of you. There's some other people I'd like to shout out, if I could, to the State Highway Patrol, certainly to some members of the Executive Protection Team, to Jason, to Marty, to Eric, to Brandon, and others. Just really being with me through some long and hard days. I'm so grateful to you and all you do to keep Ohioans safe and well on the front lines. To my fellow cabinet directors who, again, throughout this pandemic, they have been working tirelessly, whether it be protecting our congregate settings in state, from prisons to our psychiatric hospitals to places for folks with disabilities. They just work tirelessly, whether it's the Minority Task Force, whether it's ODOT. And I remember them lighting up the bridges when this first began so that we felt the pride in Ohio. They are just the most amazing team, and I am grateful. And to the governor's team, to the lieutenant governor, to Ann O'Donnell and Laurel Dawson, again, I'm learning so much from you. This is a whole new world for me, and I am grateful to you. To the team here, to Eric, who I always say next slide to, and made that beautiful video of the young girls wearing these coats that I'll remember forever. You know, to Lisa, to Dan, to the entire team here. I want to say to the press, this has been a journey we have been on together. I don't think a lot of people at home know it, but much economy was hit hard. You know, newspapers and press were already struggling in the economy, in their field, and many were furloughed during this time, but still worked weeks on and week off. But it's been so important to help educate Ohioans, so I do want to say that. To the legislators who do so much on this work every day, but most importantly, to the governor and to Fran, their passion, their deep commitment to be a governor during what is 100 years of history that has been packed seemingly into the last couple of months, to be a leader at this time. Books will be written about this, and I just feel the deep honor of serving alongside this governor, and will continue to do all I can. To my family and Eric and the kids, thank you for your patience. I really want to say most of all, though, to Ohioans. Ohioans, you have saved lives. You've done this. And it is my honor to continue to work on this alongside of you and to witness what you have done already, what you are doing right now to get back into our lives and do so as safely as you can. And I look forward to witnessing what you are going to do next, because we do have this journey together. It's challenges, but I see incredible opportunities. You know, a pandemic, it disrupts us. This little virus that we can't see, in some ways has been bigger than all of us. But I think it's also opened us to see things in new lights. It's woken us up. It's creating new opportunities. So again, I am here. I'm more determined than ever to advance the health and well-being of Ohioans and to serve on behalf of the governor. And so I just want to say this is a grateful journey I'm on, very humbled to be on with you, and we'll continue with all these colleagues, Governor, to work on your behalf.
Thank you, Dr. Acton.
Thank you.
Very, very much. We'll take questions.
This is Laura Hancock from Cleveland.com. Question for Dr. Acton. What made you want to resign at this time?
So thank you, Laura. So I've been reflecting a bit lately, not just today, but at the scope of work this has entailed. So to lead an agency, which I am so passionate about, more passionate than ever about public health in Ohio, but to lead all the work that is the usual work, as well as face this unprecedented pandemic, and also, you know, be alongside the governor to provide counsel. It was sort of 3 jobs, and we have all worked. This whole team has worked literally every hour of every day. And I'm a person who really has a very strong sense of wanting to do my very best and didn't want to let any of these things be shortchanged. So I really want to empower the team back at ODH to keep doing that work, and I'm going to keep advising and working with them. But I feel with the pandemic and what the governor is doing for, you know, really promoting the health of Ohioans, I want to give that my complete attention. And I should add that the governor has even said to me that I could take a few days or two and have some time to be with my family, who I have not been with in a little while, but also reflect and gear up for this next phase, which I think, you know, we have a lot of road ahead of us, and I want to give it my complete attention. Yes, I believe that this is effective. This transition to the role will be occurring today. Thank you.
Thank you so much.
This is a question for Dr. Acton. This is Jake Zuckerman from the Ohio Capital Journal. I wanted to ask, can you tell us where people are getting sick from COVID-19 in Ohio? I mean, to what extent is the state tracking this, and to what extent is the state willing to release information about specific outbreaks? Are people getting sick at churches, at bars, at restaurants, at work?
You know, COVID, as you know, is everywhere amongst us. And as we watch its patterns around the world, and certainly here in Ohio, that couldn't be more true. We have seen everything from, the most high-risk situations, which continue to be, in healthcare settings, in congregate settings like nursing homes, like prisons, even in disability centers, because people are living in such close proximity. But certainly, we're seeing other cases where we can't always tell where someone got it. It's the 4 C's going forward. Wonderful article today. I found that my new Swiss cheese will be a lot around the 4 C's. But I think we'll continue to see the spread of this virus in areas of close contact. That's the first C, which means, the longer, within households, it's much more likely that you'll spread it in your household because you're having that intimate time face to face. And the longer time and the closer distance, the more likely it will be. So whether that be people being out in the protests without masks if they were close, any situation like that. But we've also learned now what we can do to protect ourselves, keeping that distance, wearing a mask, absolutely recommend that. Very important thing that people are doing to keep that distance. Being outside, it's always been true with all viruses. I know some people have thought in the summer, will this virus go away? We're not seeing it's going away because it's summer or the heat, but what we're seeing is when people are outdoors with any virus, it spreads a lot less. And when we come indoors, that contact will be higher risk. So confined spaces is another C. And crowds. Obviously, when you're in a crowd, you're going to get exposed to many, many more people that you wouldn't normally come. And anytime you have that exposure, you might be at risk. So the 4 C's, the 4th C is choices. And as we're all learning how this virus works, and I think the science will continue to unfold, we'll learn ways that we can navigate our way in this world. I think we'll talk a lot more about risk. We'll have better and better data. I'm very proud of the data we're collecting, and we're collecting more every day. We're doing studies to learn more about this virus in Ohio. But it's here, it's amongst us in every possible scenario that I've seen, from people that are elderly, more at risk, people with pre-existing, to people who have never been sick before and are young. So it is amongst us, and I do hope Ohioans, I think what you're doing is working. It doesn't have to be perfect to Ohio. When we get this 80% right, we really decrease the chance of spreading this disease. So every little bit you're doing as best as you can will make a tremendous difference.
And I understand the public health guidance, but can you tell us, are people getting sick at work right now?
Yes, people have become sick in the workplace. I think you've seen places like meat packing plants. I've heard of other workplaces. So it's really, again, the good news is we have best practices. Workplaces are doing everything they can. And I want to say something else. I don't think just because we see a case break out in any workplace, in any nursing home, again, I'm really not about blame. We should understand that this virus is very infectious. We all need to take the best precautions. And certainly some places that don't, that is of concern. But even when we take the best precautions, it's a highly infectious disease, and we will see cases. Do not be surprised. But that's why all of us have to do everything we can to learn to live with this virus. Yeah.
Thank you.
Good afternoon, Governor. Jeff Reddick with ABC6.